Good evening, everyone. My name is Saleem, and together with my partner, Michael, we will be presenting chapter 17, Leadership in the Healthcare Peer Ecosystem. In this chapter, we would be basically exploring how leadership operates in the financial and organizational side of the healthcare, focusing on insurers, government programs, and employer-based peers. So So now I'm going to give you an overview of the chapter. So there are basically key topics we which would be covering that includes peer organization, leadership structures, building and managing partnerships, and navigating policy and regulation changes. So the main goal of this chapter is to basically understand that what leadership looks like in peer, organizations or peer ecosystem. These are the one which basically handle financing and coverage decisions in healthcare. And apart from this, we will also be talking about the structure of the leadership, the partnerships, and how critical leaders basically navigate policies and regulations. So the main crux or the main takeaway of this presentation is that uh, that the peer leadership would directly influences how accessible and affordable basically healthcare becomes to an average man, especially when it comes to a patient. Now, coming on to the third slide, now we need to basically understand how the healthcare payer ecosystem works. So, the healthcare payer ecosystem basically includes private insurance companies, government programs like Medicare, Medicaid, and employer based plans. So the leaders over here basically have to balance relationships between the hospitals, the patients, employers, and the policymakers who basically makes policy. So it is kind of a very complex system, one where leadership is critical, is very critical for keeping everything aligned and financially sustainable. Now, moving on to the next slide, leadership roles and responsibilities. So, there are basically a lot of roles and responsibility of a leadership which needs to be focused and which needs to be implemented to basically keep functioning a proper healthcare peer ecosystem. So in this space, leaderships are not just administrators; they basically are strategists. They overall promote value-based care along with managing the budgets, ensuring the compliance, and to build strong and foundational partnership with their healthcare providers. So a major focus should be on innovation, especially using the data analytics and digital tools, which are very, very critical in decision making. And these tools needs to be there, and they need to be a lot of focus on it. If you don't have a lot of focus on it when it comes to leadership, so it would not be an easy thing to do. It would, and it would not be something which can be done easily. Moving on to the next slide, core leadership competencies. Again, there are a lot of core leadership competencies which need to be focused on. So, to basically have a success or to succeed in this peer ecosystem, leaders need a combination of strategic, financial, and interpersonal skills. So they need to understand that the policies, they need to have an effective communication, and at the same time, the fundamental thing is that they need to act ethically as well. So out of all these things, the most important thing is they also need to be adaptable, because adaptability is really important when it comes to any matter. But when it comes to this healthcare payer ecosystem, the adaptability should be there, and healthcare is basically constantly changing, as you all know, and the leadership also has to evolve along with this. So now coming on to the case study. The case study is basically collaborative leadership example. So the scenario is that a regional peer organization partners with local hospitals to enhance patient outcomes and reduce costs. So over here, our main focus should be that how the leadership team created a joint governance model, shared data which should be transparent, and aligned its incentives towards preventive care. And you really need to understand this is quite complex, so I'm putting it out in a very very simple form so all of you can understand that. So the lesson here is that when peers and providers collaborate, everyone needs to benefit, especially the patient, because at the end of the day it's all about patient, because patient is at the receiving end. He has to basically benefit from all of this, and if there is any lacking in the policy making and all the things which I discussed in the previous slides, so a patient would not benefit in the end. Okay, from now on, this slide onwards, I will hand it over to Michael. He would basically take you through the case study, its real world applications, and the rest of the things. So now, Michael would do the rest of the presentation.
Hello, everyone, and thank you, Omar. Okay, so in this case study, we saw how collaboration between payers and providers created real measurable improvements. Which obviously promoting accountability and mutual trust. And also, I mean, the key insight is that when both sides share data and responsibility, outcome improves. There is transparency, it builds trust, and that trust drives performance. And leaders who support value-based models where payment is tied to outcome create more sustainable healthcare systems. We move on also to the practical applications. And talking about these practical applications, healthcare leaders can create transparent reimbursement in the sense that healthcare leaders can start by promoting open communications with payers, with partners, sorry, not just talking about financials, but also about patient care outcomes. And also healthcare leaders can foster cross-sector collaboration. They can also utilize data systems for strategic planning in the sense that by investing in technology, in data systems, allows payers to make smarter decisions. And finally, they can also, advocate for patient-centered policies, which ensures that financial success never overshadows patient well-being. Moving on to the next slide, which is the challenges for leaders in the payer sector. Of course, it's not easy. Leaders face constant challenges, balancing profit with ethical responsibilities, managing certain policy changes, and dealing with new technologies that can be expensive to implement. That's one. Another big challenge is health equity. Yeah, that is another challenge here, like health equity, making sure that everyone, regardless of income or background, has access to quality care. So good leadership, obviously, in this space means balancing all these factors with fairness and foresight. So in order to attain good leadership, you should be able to do this. Our engagements and discussion questions that we were able to actually bring out from This presentation is how can payer organizations build effective partnerships with healthcare providers? What ethical issues commonly arise in payer leadership? How can technology improve payer efficiency and patient satisfaction? And our last question will be, what leadership qualities are most important for success in payer systems? This is our references and resources, and thank you. This presentation was prepared by Saleem and myself, Michael Owusu. Yep, so that'll be it.